This is a hands-on course. This is a workshop, but a workshop where everything will be explained. Every step hopefully will be. So you don't get hands-on, but you get everything else in terms of learning and teaching. And it's frustrating because you're going to be here 3 days and not be allowed to touch. And every time when we have the, your comments about the course, all observers, there should be some hands-on experience. And our answer is the same, then you wouldn't be an observer. So our focus is the 5 candidates that are hands-on. So without, what we'd like to do is introduce the hands-on, Dr. Shafqat Rasool.
I'm working as assistant professor of gastroenterology at PGMA, Medical College Lahore, General Hospital Lahore.
So you know how to do EUS?
Yes, I'm just beginner for EUS. I have done like 20-30 cases under supervision.
Okay. And what are your difficulties? Because you've done 20-30, what do you find difficult? I mean, currently, like...
at times I feel difficulty in tracing the CBD in individual cap, all the way from Highland to... And then D2, I'm not good at D2. I've just done 2-3 times D2, and my main goal will be to improve my handling of the scope, EUS scope, and to learn the anatomical structures at each station. And that's it. And if maybe the scope of the workshop will allow me to do some FNA.
FNA may or may not be, to be honest, because we consider that as therapeutics. So then it wouldn't be basic hands-on. But I think once you know how to do it and once your hand is stable, FNA is really not that difficult or complicated. It's just a question of stabilizing your hands. Dr. Abdullah bin Khalid.
Assalamu alaikum. Yes. Briefly, I'm working as assistant professor in Dow Ojha campus. I had an opportunity to go for Turkey for a brief 1.5 months of EUS, and that was more of a workshop sort of thing rather than pure hands-on, but actually I managed to get some hands-on. So for stomach, within the stomach, I managed to find the thing somehow, not very confident, but beyond pylorus I'm just lost, just don't know.
Okay, so beyond pylorus.
Yes.
Are you doing it here? No. At DUHS?
Not really, just for diagnostic, maybe. Not very frequently even.
Okay. But you have a Pantax system at DUHS?
Yes, we have.
Okay. So Professor Kashif Malik.
Thank you, Dr. Saad. I'm Dr. Kashif Malik from Sheikh Zayed Hospital, Lahore. And we had this system with us in 2009. So in between, the system was out of order. Then we started again in, I think, 2016. My other colleagues were doing this. I was not interested. Honestly, I was not interested in that. But when I saw Khalid in the last endoscopy workshop and the way he was teaching and you people were trying, so because I have so many candidates with me, so I'm just interested to learn about these things. I started this. I have done 4, 5, 6 cases with Dr. Farooq from UK. And so I am just a beginner. I'm just going to station 1, station 2, not beyond that. And honestly, because I'm a beginner, I need more practice for doing this, because my other colleagues are doing, so we can have a good setup there in Sheikh Zayed Hospital to train the people. My main aim is to train my trainees. I'm not very much interested so going beyond this.
There's not much more I want to know from Kashif. Ye batai, Dr. Kamran Hassan.
Thank you, sir. I'm assistant professor in Leading Hospital, Peshawar. Way back in 2014, I had an opportunity to go to Japan, and over there.
Was it 2014?
14, yeah.
Oh my
and
God,
I had some basic EUS training over there, but when I came back, I discussed with your good self as well, we had lots of problems and about the infrastructure and the availability of the scopes. And now that the scopes are available, I am once again here to.
So you've got your system out of the box?
Maybe in this PhD. we hope you.
Because I found out that it had arrived, but it's still in the box.
So I've done just few diagnostics and 1 or 2 EUS-FNA under supervision in Japan in 2014. So it's a long way to.
Good. So you already have a system, and there is nobody doing it in.
Right now, nobody
in
is doing
KPK.
it. Yes, sir.
You know?
Yes.
Okay.
What system is
Pentex, sir.
Fantastic. Okay. Before I move to observers, 2 points Dr. Kashif, I think Professor Kashif has actually made. One is that I had an email, not me, Sajda had an email from an applicant, very upset as why he was not selected. And he had applied earlier and he wanted to know what the criteria was. And I was polite, so I didn't tell him, you know what, I select, look at the face and I decide. Okay, that's my prerogative. We are not obliged to select. We try and be as fair as we can. We look at different provinces, we look at your availability. There is no point me bringing you here. You don't have anything to go back. And I'm going to share during this course how I got into this. Very similar to where you are is what happened here. I mean, we didn't have a EUS facility here. And I was hoping somebody would come from America or UK, and you know, we had someone who was my name. He came, stayed here for 2 years, wo jo American wala system hota hai, and then he decided to go back. And so we were in that. So that's how I got into it. And the gentleman sitting here, my teacher, Khalid, he was introduced to me by an Indian. I didn't know Khalid at all. It was Shyam that I knew. We became friends, and then he introduced me to Khalid, and then the rest is history. And Karachi, kam se kam, I can say that Khalid is the man who's behind EUS. Hopefully, whatever we do in EUS from this setup is completely, we owe it to Khalid. So it's never too late. If I can do it, I am sure anybody can do it. Observers, Dr. Tanveer Hussain.
Assalamu alaikum. I am Dr. Tanveer Hussain, Assistant Professor at Rawalpindi Medical University, sir.
Okay.
So we have the instrument, but we are not supposed to be do the EUS,
You have the instruments?
Yeah. But Dr. Busha is doing, but we are not supposed to be
Oh, you are with Dr. Umar's unit?
Yeah, partially.
Partially.
Yeah.
Okay, complicated.
So I'm just here, to just.
But Dr. Umar and Dr. Bushra ke unit mein, they are doing EUS.
Yeah, they are doing it.
So, okay.
Yeah.
Must be some. So you have not had any experience before?
No, sir, I have no. We have seen the cases, while they are doing, but we actually, I never did.
So what will happen is you will have 3 different approaches slightly. One very simple and basic, that's me, and 2 professionals here. And then you will pick up and see what suits you. Okay. Dr. Nandlal.
Thank you, sir. I am Dr. Nandlal, working as Assistant Professor at LUMS Jamshoro, the Department of Gastroenterology. Actually, we don't have a EUS scope in the private as well as government sector.
I have been told ISRA has acquired EUS.
No, sir.
No? Order de diya?
To me, they may give order, but
something like that. Because Sadiq Mehman wrote to me that, sir, we have ordered or we've received, I can't remember, but unka ek email hai. So you've had no experience?
No, sir.
I think for encouragement जिस लेवल पे आप दोनों है ना, this course is really very useful, I feel. I've learned in the last 2 courses a lot, and I'm sure I'll learn in this course and if we continue doing it. Especially one of the concepts that Kashif mentioned, that when you sit down and see the experts doing it, everything looks very difficult. When someone like Khalid or Ghiyas makes it simple, suddenly you realize, oh well, it's not that difficult. And so, आपके
Yes.
basic foundation जो है ना, this course is about laying the right foundation. It's not about you going out after 3 days and being able to do it independently without anyone. This is about telling you what are the basic principles of EUS, how do you do it, and then obviously it's just going, finding someone who is doing it, and if you start doing it, it should be much easier. So a lot of things I was discussing that I had problems with when I started, and Riyaz probably would relate, especially because we started late. What we have learned and the difficulties we face, we try and simplify that for you so that you don't have to go through that while you are actually learning and improving yourself. Great. Dr. Imran Arshad is here? No, he's not. Dr. Akram Bajwa is here? He's not here. And Dr. Ghulam Abbas is here from Rahim Yar Khan.
Assalamu alaikum, sir. I am working as a consultant gastroenterologist at Sheikh Zayed Hospital, Rahim Yar Khan. And now it's my 3rd month. I am working under your kind supervision over here. And my EUS observer experience in this unit. And now I am learning more.
Okay, Ghulam Abbas is our 3rd candidate. We've started this 4-month short ERCP fellowship where we get you from wherever you are. Again, if I like your face. And then over 4 months, we give them ERCPs, and hopefully by 4 months they would have about 200 to 250 ERCPs. And then they can go back, if they're good enough, we'll certify them, and then they can go back and build on their experience. We've done 2 before, one in Peshawar, one in Quetta, and this is now Rahim Yar Khan. So we're picking up areas where the service is not available, ideally. Okay, with that done, I think, are we connected? There was one mishap. I had a call from Mustafa Arai day before yesterday, Friday night. I think it was Friday night, no? His mother was very concerned about him coming or leaving US because of the viral issues that are currently affecting China mainly and probably the rest of the world. Although I just heard yesterday in the news that the first case outside China has been detected, and I'm sure. क्या हुआ? करना है ना? हाँ 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 मैंने आपको भेज तो दिया था स्काइप आईडी. हाँ तो वे तो आप कनेक्ट करेंगे ना. तो वो तो उसको नहीं, तो उनको तो सिर्फ उनको रिक्वेस्ट भेजनी है ना. हाँ हाँ तो हो जाएगा. ही शुड बी देयर.